Every few years, there's an international meeting to discuss the latest guidelines regarding concussion and concussion management. So, back in October of last year, a panel was formed and they all got together in Amsterdam and they just released their findings on the latest guidelines. And in this video, I want to dive into the newly revised definition of concussion. During the 2022 consensus, they redefined it, and it's quite long, so we'll break it down piece by piece. They start off by saying that sports related concussion is a traumatic brain injury caused by a direct blow to the head, neck, or body, resulting in an impulsive force being transmitted to the brain that occurs in sports and exercise related activities. This is really important, and I think you'll find how, as we progress through this entire definition, it does a pretty good job at debunking a lot of the myths surrounding concussion. So, for this part of the definition, they are stating that you could really be hit anywhere on your body as long as that force can be transmitted to the brain, which can then lead to one sustaining a concussion. Actually, striking your head is not a requirement for concussion. The second point they have here is that it initiates a neurotransmitter and metabolic cascade with possible axonal injury, blood flow change, and inflammation affecting the brain. Now, we've known about this for a little while, and you can find videos that I've done, like this one here, discussing what actually occurs to your brain once you sustain a concussive blow, and this cascade of events that occurs within your brain, and how that physiological change then translates to our management strategy. Next up, they state that symptoms and signs may present immediately or evolve over minutes or hours and commonly resolve within days, but may be prolonged. This is important because this is another myth that surrounds concussion, that someone will say, well, I felt fine when I got my bell rung on the badminton court, but then I started noticing all these symptoms a little while later. Newsflash, they're probably related. This next one is critical. They state that no abnormality is seen on standard structural neuroimaging studies, as in a CT or an MRI, but in the research setting, abnormalities may be present on functional, blood flow, or metabolic imaging studies. So, what they're saying is that if you were out playing a sport and you get rocked, there should be no abnormalities on the standard imaging that would be done at, let's say, the hospital setting, or maybe performing any imaging studies at all was not indicated. If there is, then you would fall more so into the bucket of a traumatic brain injury, which I understand can be a little confusing because technically a concussion is a traumatic brain injury, but we want to be able to give someone the lowest possible diagnosis. And so if there were findings on standard imaging studies, we know that at the very least, they now qualify as a mild traumatic brain injury and possibly even moderate or severe. So unless you have access to some real fancy imaging modalities like the ones that they stated before, you cannot receive a true concussion diagnosis with a positive either CT or MRI. Lastly, sports-related concussion results in a range of clinical symptoms and signs that may or may not involve a loss of consciousness. The clinical symptoms and signs of concussion cannot be explained solely by drug use, alcohol use, or medication use, other injuries, or other comorbidities. So, do you have to lose consciousness in order to sustain a concussion? Well, you heard it here first, that according to the latest definition of concussion, it may or may not involve a loss of consciousness.